everybody. Thank you for tuning into this video. My name is Lindsay DiCarlo, and I'm the Outreach and Recruitment Coordinator at the University of Wisconsin Madison School of Pharmacy. Today, I'll be talking with Dr. Andrea Porter, Associate Professor and Director of Pharmacotherapy Laboratories in the Pharmacy Practice Division here in the School of Pharmacy, about her responsibilities here at the university, along with her work as an ambulatory care pharmacist. Thank you so much for taking your coffee break with me today, Andrea.
Thanks so much for having me here today. It's great to chat with you.
Oh, it's so great to talk with you too. So to kick us off, got to get into it right away. I know you teach two main areas. So can you briefly talk about your classes you teach and the importance of the content and preparing students for their future practice?
Of course. I teach in a variety of courses here at the School of Pharmacy and really focus my teaching efforts, as you mentioned, in two main areas: teaching student pharmacists pharmacy practice skills and experiential learning. I teach two courses in the first year of the Doctor of Pharmacy program, and in the fall semester, I co-coordinate the Pharmacy Integrated Learning Lab. This is a really fun interdivisional course that includes instructors from pharmacy practice, social and administrative sciences, and pharmaceutical sciences. In this course, students learn a lot of different aspects about pharmacy. So pharmacy practice skills, such as taking a medication history and patient counseling, to medication calculations and drug formulations, to communication skills. A really neat aspect of this course is that students also work in a team for a longitudinal group experience with an older adult in the community to apply course content. So while students are learning the content and the skills in the course, they're able to apply what they're learning in real life to their older adult partner, starting their very first semester in pharmacy school.
Oh, wow. So students get to see patients as early as their first semester freshman or first year. Wow, that's really beneficial.
Yeah, it's a really, really neat course.
That is.
In the spring semester of the first year, I co-coordinate the Pharmacy Practice Experiences 1 course. And students spend 40 hours in a community pharmacy setting, really exploring the role of the community pharmacist, the many different patient care opportunities offered in this setting, as well as the pharmacist's role in public health. This has become even more visible recently, with pharmacists providing COVID-19 vaccinations and offering testing for patients at their pharmacies. First-year students are able to immunize during this rotation, which is really neat. In addition to the community pharmacy practice experience, students continue to work with their teams from the fall semester, so they continue that relationship with that older adult partner in the community, which really makes it a true longitudinal experience over that entire first year. The next thing I wanted to talk about is another aspect of the course of courses that I teach in, and it's in the second year of the program. So I coordinate the integrated pharmacotherapy skills courses in both the fall and spring semesters of the second year, where students continue to learn their pharmacy practice skills. We really focus on counseling patients on their medications, so including educating on devices such as inhalers, nasal sprays, and injectable medications. And students also learn how to manually take a blood pressure, heart rate, identify and resolve drug-related problems, document the care they provide, and also how to communicate with other healthcare professionals. Lastly, I lecture on a variety of topics in the pharmacotherapy curriculum related to my clinical practice, and I am a practicing pharmacist. I lecture in the cardiology section on anticoagulants and antiplatelet medications, venous thromboembolism, which is blood clots in the legs or lungs, and an irregular heart rhythm called atrial fibrillation.
Wow. That sounds really fun. I want to be a student here. So, okay, we're going to touch a little bit more about hands-on learning. So you've mentioned that students get to, I've commented about that earlier, get hands-on learning right away as soon as they start the program. So what other opportunities are there for students to gain that hands-on experience?
I've already talked about the community pharmacy experiences that students have in the first year, and students continue to have introductory pharmacy practice experiences in their second and third years in our program in community, hospital, and elective pharmacy settings. So those first 3 years total 300 hours. Wow. Our fourth year of our program includes full-time rotations for over the course of an entire year, which is about 1,440 hours. Our school has a wide variety of rotations across the country and globally that students can take rotations in. Lastly, students have hands-on interprofessional education activities throughout the curriculum where students learn along with other health profession students during very intentional activities.
Mm.
Additionally, there's many student organizations here at this school that provide wonderful opportunities for students. Some examples of community outreach activities include students participating in immunizations, heart disease education, and women's health. There's free clinics in the area where students can provide patient care alongside other health profession students. And also there's student organizations focusing on a specific area of pharmacy, such as clinical pharmacy or pediatrics.
Oh, sounds really like a great part of the program. So thanks for talking about that. So now we're going to take it a little bit outside of the school now in regards to your role. So you work at the VA hospital just down the street from the School of Pharmacy in the ambulatory care pharmacy. Can you explain to those of us who don't understand what ambulatory care pharmacy is, and if you specialize in the area, can you talk about that?
Yeah, so I'm a pharmacist in the Anticoagulation Clinic at the Madison VA. I talked previously about how I lecture on anticoagulants in the curriculum. So anticoagulants are medications that prevent the blood from clotting. The blood still clots, but just not as well as if you weren't taking the medications. So one of them, warfarin, was developed here at UW-Madison. These medications are considered high-risk medications due to their risk of bleeding. And what we're trying to do is prevent blood clots, such as a blood clot in the lung or the leg or a stroke. But in doing so, the patient doesn't clot as much and there is a risk of bleeding. At the VA, I am considered a mid-level provider and have a scope of practice that allows me to prescribe medications within my scope. So I monitor and manage patients' anticoagulant medications, which means I talk with patients and I assess how are they doing, see if anything needs to be changed. And if it does need to be changed, I can make those changes directly. So pharmacists work in anticoagulation clinics, as I mentioned, is not a unique pharmacist role to the VA. There are many pharmacist-run anticoagulation clinics across the state and country, and they may be arranged and managed a little bit differently than my clinic is at the VA, but pharmacists can have a really large impact in this area and on patient care.
I see a lot of prospective students asking about that, so thank you so much for highlighting that aspect of your job. I think it's definitely something that can excite a lot of students to come to pharmacy, so thank you for that. Mm-hmm. So if anyone is inspired by the type of work you do, the type of area you practice in, are students able to be competitive for that line of work after attending our program?
Definitely. So graduates from our program take many different courses to prepare them for a role in ambulatory care pharmacy. Students learn about medications through their pharmacology and pharmacotherapy coursework. They also learned pharmacy practice skills in the skills labs that I've talked about before, and really apply everything they've learned to the real world throughout our fantastic experiential rotations, both in the first 3 years of the program as well as in that 4th year. In order to practice in a role such as mine, students after graduation will need to complete a pharmacy residency, which could be an additional 1 or 2 years of training. Graduates of our program currently have a high residency match rate, meaning that our program sets students up for success.
No, this is brief. I would love to talk to you so much longer, but we're going to keep this video brief for everybody. So we're going to end that today. So thank you so much for joining me on your coffee break. I know you're super busy doing amazing things in our community at the VA and for our school and for educating the next generation of pharmacists. So thank you so much for having your coffee break with me, and I hope you have a great day.
All right. Thanks so much, Lindsay. Really appreciate being here today.
Talk to you later. Bye.
Bye.